Terrifying tongues with teeth, nightmarish levitations, and this is not going to end well. Today, we're breaking down and reacting to some of the most intense injuries and wild medical scenes from Stranger Things. Let's dive right in. Oh! Holy cow. Puncture wound to your left flank. Anybody out there know what's in your left flank? You have your spleen that sits there. Then you also have your descending colon. Further back, you end up having your ureter and your kidney. High up there, you might actually even catch the bottom of the lung. Puncture the diaphragm. If you puncture the lung, a pneumothorax. If the diaphragm actually gets ruptured, the contents of your abdomen could actually go up into your chest cavity. We actually see this often when people have different types of hiatal hernias. Oh, jeez. Oh, man. I believe that's the Demogorgon.
The Demogorgon!
Correct me if I'm wrong, it's fine.
The Demogorgon is tired of bickering!
Going after the chest and the heart. We saw all those teeth, and so it's able to break down the chest wall, get into the heart, versus like you'd think they'd go after the head or the face.
In your face!
We see penetrating traumas, we would have to do our trauma protocols. A, B, C, D, E's, they fit just in the A, B, where you worry about the airway because of the lung, and then you do your C's because blood pressure, heart rate, blood loss, all related, could have a major effect relating to your splenic type injury on that left flank. Ooh. Bleeding from the mouth, teeth look a little broken. Most of the time, like the lips will bleed because they hit our own teeth and it causes laceration that way or explodes open. The things we worry about have to do with through and through, like cut on the outside as well as the inside. Could be a lot of bacteria. It just has a higher risk for infection.
Go to hell!
Oh, heavy metal and a lot of weight to it. If it hits the nose, you could fracture the nose, cause bleeding, and you might pass out. If it hits your forehead, you have your frontal sinuses there, so you can break both the outer and the inner part of the frontal sinus. You can crack all the way into the skull, puncturing brain tissue with your own bone. Stab right above the manubrium. If you puncture straight into the airway, you're having the airway issue. Esophagus, you're going to have to worry about infection because now there's the junk from our eating and mucus getting into wrong cavities, and then the airway as well, especially if the junk gets into the airway. Oh, geez. Oh. It's so funny in movies they use silencers or suppressors, right? They'll have some sound that goes off, but I guess if there's enough noises around, it gets hidden in there. Oh, okay. We're shown this is a lower sternum epigastric area injury, really directly where your heart is. So your heart is centered to the left, but this definitely would go straight through the heart or a structure is very close to it. Or it might be low enough that it's just in the epigastric area. If it hit the heart and ruptured through one of the chambers of the heart, what happens is the blood escapes into the mediastinum, which is the space where your heart is. It'll then compress your heart down to where you're not pumping any more blood out. Versus here, he's awake, complaining of pain.
Easy.
Could be your stomach, but the other things you worry about is your aorta that comes behind it on the backside, which is your major blood vessel. That could cause significant bleeding and you can die pretty quickly. If this doesn't take your life, then the issue ends up being infection, blood loss, and the recovery aspect. You as a bystander, what would you do if you were in this scenario? Obviously, you gotta call 911 and then be with the individual as long as the scene is safe and you wanna compress the area as best you can. Oh my gosh, huge. You ever watch a show like Stranger Things and have the hairs on the back of your neck stand up? You're definitely not alone. That's why I created Chillax to help you stay calm when things get a little more intense. Find it at lifehappens.com or on Amazon. Ow, he's got his hands in there. The hands might be getting eaten. The tissue might be sloughing off. We see that when people get burns. We see that when people get bad road rash. Sometimes there's something called degloving where the skin gets pulled off. Puncture wounds, so we get puncture wounds to either side because of the claws. So liver, spleen, get potentially injured, fractured ribs, as well as punctured lungs. I mean, if somebody comes in, there's going to be a lot of work that needs to get done.
We have important work to do.
Oh my gosh. I'd be freaking out. Has anybody levitated in their life? Let me know in the comments. Chris Angel, right? Chris Angel, if you're watching, show me how you do it. Oh! That is a fracture dislocation of your elbow. Why do I say fracture? Because the way your anatomy is, to be able to hyperextend it in such a way that causes it to snap like that, you wouldn't be able just to dislocate it. You'd have to snap the olecranon off, which is your elbow piece, but then it will dislocate out of socket after that because now you don't have a socket. This leg just gets totally destroyed. Tib-fib fracture, so the tibia and the fibula fractured again. You need to splint that in the appropriate anatomical alignment when it comes in because of the vasculature, plus it'll help decrease the bleeding. Oh my gosh. Nice jaw fracture versus dislocation. Most jaw fractures occur in two places because you get hit on one side and the energy goes out the other. So you typically have one fracture here and then the other side going through. Stranger Things. Oh my gosh, it's so scary. So why did the nose look like that? We see that depicted in many different shows, movies. The tip of our nose is cartilage, but the rest of it is bone. So the cartilage is gone, the connective tissue is gone, but the bone is still there. So that's why we see that. You just hear the crunching and the breaking of the bones. Most of the time when we see people with massive, multiple fractured injuries, it's due to falls from great heights or bad car accidents. Those are usually what we see. Would all these broken bones cause you to die? No, not necessarily. You do worry about blood loss and inflammation. Every bone has blood running through it. Eventually, you're going to have a significant amount of bleeding when you have fractured bones, if there's a lot of them. Airway, breathing, circulation, you're supporting the individual, getting things realigned so then you minimize blood loss. So, wow, Stranger Things. I haven't seen it in a long time. It just brings back nightmare memories of the show. Also, check out my limited edition Dr. ER apparel, available now for a short time only. Once it's gone, it's gone. So grab yours before it's too late at shopdrer.com. If you want me to do more Stranger Things, let me know in the comments as well. And definitely check out this playlist right here. Make sure you binge watch everything and subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching and stay healthy, my friends.